Encik Yusof, Puan. It's nice to see all of you today. How have you all been since the last follow-up?
Good morning, doctor. We have been doing well. I feel okay.
We are doing well also, doctor.
I see that your son has joined today.
Yes, doctor. I try to complete them whenever I'm free.
Oh, that's good to hear. So since Encik Yusof has several medical conditions, today I'd like to review his overall condition, so his overall health, his medications, lifestyle, and also to hear from the family about how he's been doing at home. Is that alright?
Yes, doctor.
So Mr. Yusof, how do you feel about your health currently?
I think I am okay, doctor. Everything is good.
How has your daily routine been recently?
Mostly I stay at home. I spend time with my grandchildren and also watching videos on my phone.
Able to do your daily activities independently, like bathing, dressing, making food, going to the toilet.
Yes, doctor. I can still doing everything myself.
So Puan, from your perspective, have you noticed any changes in him recently?
Okay lah, he is quite independent lah, semua buat sendiri. Tapi what I notice and my son notice also, he macam less active already. He like to spend more time sleeping, sitting compared to before lah.
Yusuf, why have you become less active recently?
I don't know, doctor. I just don't really like doing anything much.
I understand you have several medical conditions, including diabetes, darah tinggi, high cholesterol, heart disease, where you just recently undergone surgery, hepatitis B, prostate cancer, and as well as arthritis in your knees. So how have you been coping with having all of these conditions?
So far, okay, doctor. I attend all my appointments.
Okay, so let's review each condition that you have briefly. So regarding your heart condition, after your bypass surgery, are you still attending follow-up with the cardiology team?
Yes, doctor.
So during your recent visit, did they perform any tests such as an ECG or ultrasound or echocardiogram?
Yes, they did, doctor. Actually, I don't really remember, but the doctor said that everything was stable and they asked me to continue my medication.
Well, how about your follow-up for hepatitis B? Do you still go for that with the liver specialist?
Yes, doctor. They did some blood tests for me and ultrasound, and they said everything was fine.
Have you noticed any symptoms such as having yellow eyes or feel like your stomach is distended, like getting bigger? Feel like you don't have appetite to eat or any weight loss recently?
No.
About your diabetes, have you noticed any numbness in your hands?
I don't think so, doctor.
Do you notice if your legs are swollen?
No.
Do you notice if there's any bubbles in the urine?
Also, no bubbles in my urine.
Pain in your calves? After you walk for a certain distance, you feel like your legs are macam cramping.
No, doctor.
Cik Yusof, can you tell me how you usually take your medications at home?
I usually take them every day. Actually, most days.
When you say most days, does it mean that there are times that you will miss medication?
Yes, doctor. Sometimes, maybe 2 to 3 times a week. Sometimes I usually miss the evening medication. There are a lot of tablets, so I tend to forget. Maybe when I feel well, I think it's not important for me to take it.
Puan, have you noticed if Mr. Yusof is missing his medications at home?
Adalah, I will remind him, but I also very busy, doctor. Still working, I tolong jaga anak-anak. Then he will forgot to take lah kalau I tak remind him.
Doctor, I also have noticed whenever sometimes I visit him, right, his medication box is still full of tablets. I go and ask him why he take medications. He tells me he forgets, or sometimes he thinks that he's good already, so he doesn't need to take medications anymore.
Okay, so it sounds like the main problem is not that he refuses to take the medication, but maybe because it's hard to take because there's quite a lot of medications, right? So you tend to forget. I think I could refer you to our pharmacist and they could help us find ways to make this easier for you. So now, Cik Yusof, we have reviewed your medications. So now I would also like to review about your lifestyle. Okay, so from here, I noticed that your weight has reduced from 80 kilo to 75 kilo. May I ask what changes have you made?
I just reduce my food portion a little, doctor. Usually I eat rice with fish, chicken, and also vegetable. But I do enjoy eating fried food and also fried chicken. Sometimes I eat bihun goreng and a cup of teh tarik every day. And I also like fruits.
Do you usually eat outside or mostly home cooked meals?
Mostly home cooked, but sometimes I eat outside with my family.
How about snacks in between meals?
I don't really snack in between them.
That's good.
I know I should reduce my oily food, doctor, but I've been eating like this for many years.
Yeah, I understand that it's difficult to change habits suddenly, and since you're so used to it and it tastes good, but the ultimate goal here is not to completely stop taking foods that you like, but we can learn to make healthier choices gradually. So, what do you think of his lifestyle at home?
Like I say before, after makan pun, he will just lie down, doesn't like to exercise.
Doctor, I also noticed that whenever in the evening I ajak him go walking, right, he says he's tired and he doesn't feel motivated.
So I'd also like to briefly ask you about your arthritis in the knee. So how are your knee currently?
Sometimes it is painful, doctor, especially when I walk for a longer distance, but it is manageable.
So has the pain become worse recently?
No, doctor, it's almost the same.
Are you able to walk independently still?
Yes, doctor, I can still walk independently without walking aid.
That's good. So since this arthritis of yours is quite stable and is not significantly affecting your activities, so we'll continue with the current plan. I think it's important to note that staying active with suitable exercises can help maintain your mobility. So after discussing everything today, I think there are a few areas where we can support you better. Firstly, we need to improve your adherence to your medications because we want to make sure all your treatments are working effectively. Setting reminders on your phone, or maybe having a pill box that has indication for how many pills you need to take, and your wife and son could also help reminding with that. Secondly, it's important to improve your diet and lifestyle to protect your heart and to also to control your diabetes, such as reducing any sweets, any salty or oily foods. More exercises in your daily routine, so it's good to have like brisk walk for at least 30 minutes a day. Okay. And thirdly, we should maintain your mobility despite your arthritis, and so I could help start you on pain management. If it gets bad, then you can take the pain medication to reduce. I would also involve other members of treating team to support you in your treatment. So we have a pharmacist that can help review your medication and find ways to make it easier for you to remember them. And also I have refer you to dietitian to help you plan your meals that's suitable for your condition, for your diabetes, for your heart disease, but you can still enjoy your preferred food, so they'll have you plan with that. As for your arthritis, we have a physiotherapy team that can guide you on safe exercises to maintain your mobility. So after hearing all this, would you be okay with this?
Yes, doctor, I think that would be helpful.
Yes, doctor. Thank you so much. All this, I think this guidance will help a lot.
I agree, doctor. I also can help with reminding him, supporting him at home.
So that's excellent.
Okay, good morning to you, Sof. So I am the pharmacist here. So I understand from the doctor that you sometimes miss your medication. Thank you for being honest with us. Can I ask what makes it difficult for you to take them regularly?
Actually, sometimes I forget to take it, especially when I have a lot of medication at home.
Okay, so I understand. So someone that takes a lot of medication, sometimes it can be confusing. Can you show me how you usually organize your medication at home?
Usually, I just keep them all together, but I take it when I remember.
Okay, so we have a lot of approach we can make it simpler. So some of them can be you use the weekly pill organizer. So it's kind of like pill box. So you know pill box?
Yes.
Okay, so you put your medication there, so you take so you can take that every day regularly lah. Second, strategies you can set your reminders on your phone. So if anytime you forget, the notification will pops out. It can remind you to take the medication. And other than that, you can also link your medication with your daily routine. For example, you take it after breakfast or before you sleep. It will be easier to remember lah. And other than that, you can also keep a medication list at home. So you can know what the medication you take, because there's a lot of medication you have to take, right? So you can remember everything, so you have the medication list. Do you understand?
Yes, I think the pill organizer and also the phone reminder might be helpful for me.
Okay, good. good. So another thing that is important is for you to understand why you take all the medication lah. So for example, you take the heart medication, right? So this heart medication you have to prevent future heart problems or heart complication, or cholesterol medications to reduce the cardiovascular risk, and your hepatitis B to helps for your control infections and also to protect your liver. Even if you feel that you are well, the medication are still working to prevent the complications.
I think I understand now. Maybe because I feel well and I often thought that missing one or two medication would be nothing.
Yeah, many people think that way, and it can become a habit lah. So it is important for you to recognize it now, and you can work on it to improve lah. And Puan and also your son also coming, right? So they can also support you, but the most important thing is for you to be more confident to manage your all medication.
Good morning to you. So I'm the dietitian here. So I understand you enjoy fried food and also the diet, right? So I'm not asking you to completely stop taking the foods that you enjoy. So we focus on making realistic changes lah. So we can start with reducing fried food and choosing grilled, steamed, and also soup-based option more often. And then we also can use quarter half portion method. So for example here, okay. So in quarter half method, you can take half plate of fruits and also vegetables, and then another quarter can take protein and also carbohydrate lah. So beside this, you also need to reduce your sugary drinks and choosing healthy option lah. Okay, is it okay with you, Mr. Yusuf?
Yes, I think making small changes would be more realistic for me.
Yeah, exactly. So changes that you can maintain long term are more important than making sudden straight changes. Okay, so thank you. And so far, you have any question?
Nak tanya doktor, macam saya, if I want to prepare like chicken, daging, macam mana I prepare macam normal je ke, or memang kena special for him?
So for chicken, you boleh remove dia punya skin lah. Lepas tu make sure macam daging dengan ayam tu tak ada lemak. Okay, lepas tu kalau you masak, you boleh like tukar daripada, instead of you use normal cooking oil tu, you boleh try punya olive oil. Lepas tu macam canola oil. And then macam tadi I mentioned that about fruits kan. So kalau boleh yang fruits tu you ambil yang the original fruit lah, not the juice one.
Tak boleh minum jus lah masa tu.
And then make sure dia like in moderate portion lah, jangan terlampau banyak. Okay.
Faham? Kalau macam kami biasa makan nasi lah doktor, so dia boleh ambil nasi.
Encik Yusof boleh juga ambil nasi, tapi you kena limitkan lah portion dia. And then saya boleh suggestkan untuk you tukar to brown sugar lah, sebab dia apa ni, Encik Yusof kan kecil manis, ada masalah jantung juga kan.
Yang nasi orang kasar macam tu lah, brown rice. Okay, boleh tak? Thank you.
Okay, so Cik Yusof, after meeting with the dietitian and pharmacist, I hope you have better understanding for your condition and also how to manage it. And so thank you so much for your time today, and also your wife and son, and for sharing honestly with Mina. So I'm glad that your wife and son are in court.
Thank you, Doctor.
Right, so excellent. Thank you so much, everyone. I will see you during your next follow-up.